Good morning, everybody. Glad you're here. This is, gosh, I think I only have 2 more sessions out after this. So this is our 10th session of the New Mexico Data Users Conference. And the rest of today, we're actually going to be focused on really New Mexico specific data. Given that we're very concerned about healthcare, given the pandemic and everything, I thought it would be very useful to look at healthcare data in New Mexico. And we've had Lois Haggard from the New Mexico Department of Health Community Epidemiology Bureau work with us before and talk to us, but they've done some upgrades on their platform that puts out public health data. It's called New Mexico IBIS. It's the New Mexico Indicator-Based Information System for Public Health. And there is so much data out here. In fact, UNM Geospatial Population Estimate Program people who do the population estimates between the decennial census for New Mexico have a contract to do their estimates and then their forecasts, and they give those to be published in IBIS because it's the basis for a lot of data that you need when you're looking at healthcare. Without that further ado, I think I will introduce Lois Haggard here and let her take over and show us the data portal for healthcare data in New Mexico.
All right, thank you, Susan. So as Susan said, I'm Lois Haggard, and I'm going to be talking about NM-IBIS. And, let's see, why did there we go. Boy, that was slow. Okay, this is what I looked like 9 months ago when I, was able to get haircuts. My hair is not like this anymore since I haven't had a haircut since February. But I just wanted to say, first of all, that I'm really grateful to have been invited to speak to everyone. I think this is a really valuable conference that Bieber does every year and that Susan puts on. And yeah, I'm just really happy to be here. Okay, so NM-IBIS. Here's just a brief history. The website, web-based system was originally funded by a CDC grant through the Utah Department of Health when I was in Utah. And I've been in New Mexico, it's 13 years, going on 13 years. And so this was around the year 2000. I think it was actually 2001, the Assessment Initiative grant. So we've been working on this guy since for 20 years, which is kind of hard to imagine, but there you have it. It was designed by public health practitioners, me and a group of others, for public health practitioners. So that's one thing that differentiates IBIS from, there are a lot of these applications now that you can use for dashboards and stories and web-based data visualization. This one is a public health platform. So what we wanted was easy access to our public health data. We were awash in data, but couldn't really use it. Now, if you think 20 years ago, our vital records data were on mainframe computers. There may be some of you who don't even know what that is, but it was like a big room full of a computer, and you had to have special skills to use it and to get information off of it. And we wanted an easy way to access our data. And the other thing that was important is that we thought we needed to provide some context along with the data. So, not just a number, 42, for instance, but what does it mean? We needed to provide some context. What does the data mean and why should we care? And we wanted to be able to maintain the software in our department on the business side, as opposed to having our IT staff maintain it. We had things we wanted to do, and we wanted to be able we didn't want to have to depend on IT. We wanted it to be easy to maintain, and we wanted control over it. And then the other thing is we wanted it to, we designed it with the intention of sharing it with other state health departments. So the woman who was my predecessor, Wu Shu at Utah Department of Health, she firmly believed that if you worked with other states and you had a lot of partners, your product was a much superior product to what it would be if you were working in isolation. And I think that has proved to be true. We've been very lucky to have a lot of partners across the country. So this is a US state map with the blue states showing state health departments that are using IBIS, that have a public IBIS presence. And some of the states you'll notice have green triangles, and those are states that also use the IBIS software for their environmental public health tracking network portal. So it's a kind of a portal that's really similar to what IBIS does with indicators and queries, but with a very environmental health, more narrow focus and specific requirements, and they all feed into a national network that's looking at environmental exposures, health-related environmental exposures. And then we have one tribal epicenter, United South and Eastern Tribes, and together it's a dozen partners in our IBIS community of practice. And if you're interested in learning more about the community of practice, there's a URL at the bottom of this slide, trac.ibisph.org, and that is a site that gives you links to the other public IBIS, available IBIS websites. Okay, here's our vision statement. We believe all persons will have, in an ideal world, all persons would have quick and easy access to up-to-date health data for all priority health issues presented in a public health context for all populations of interest with national benchmarks at the smallest geography available in a format that is engaging and easy to understand and easy to print or download. And, we keep chipping away at this, and I think we're doing pretty well. If you've worked a lot with web applications, sometimes that last bullet, easy to print, can be a little challenging. Getting you can print the page and you can print multi-page documents, but sometimes it's a little hard to get it to look the way you want it to look. But anyway, we're still working on it. Okay, so this is an informaticist type perspective. What we're trying to do with IBIS is turn data into information. So data gets turned into information by doing analysis, providing visualizations that make the data more intuitive, and putting it in a context. So here I'm showing a map with death rates by county in New Mexico. And it's pretty easy to see, I think, that the darkest color, the dark purple, has the highest death rates. So these are the counties where New Mexicans are dying at faster rates, or you could say are dying at younger ages. So we want our information to be relevant, meaningful, timely, and useful for decision making by public health practitioners, with the ultimate goal of enhancing our ability to improve population health outcomes. An informed civilian populace. Okay, so this is a little analogy that I really like, and it compares a clinical doctor visit to what we do as community health doctors. So in your doctor visit, you go in, you have a presenting complaint. This is your subjective information. You tell the doctor, I have a sore throat. And then the doctor collects objective information. Take the temperature, take your blood pressure, look in your throat. And then the doctor makes an assessment. What's the diagnosis? And comes up with a plan. Does this patient need antibiotics or just rest and fluids? So in the community, as a community doctor, we get our subjective information from community members, advisory boards, community-based organizations. There are a variety of sources that in the community that provide subjective information. And then we need to look at objective information before we make our decisions. And this is really where IBIS and the state data center data, BIBR and GPS come in. So on IBIS, we have morbidity and mortality rates, quantitative survey data, data on socioeconomic status, and other things. So that's what I'm going to be talking about today. And then as a community doctor, we have an assessment. And one of the main assessments we make in community health is deciding what are the priority health and safety issues for a given community. So we have to prioritize by looking at the data and then make a decision about what interventions will be most effective. All right, so before I launch into examples, I want to talk a little bit about this new version of IBIS, the Tale of Two IBISes. So our current production version, if you go to this URL right now, you'll go to this current version on the left, and it's great, it's fine. I'm keeping the query, when you click on Explore Datasets, I'm keeping the query data up to date, but I have to confess that the indicator report data, since those reports have a more manual aspect to them, we have switched over to the new system, and you won't see the updated indicator report data until we release IBIS 3.0. And I hope to do that by the end of the year. That's my fervent wish, because I promised the department I would get IBIS 3.0 out before I retired. And, you know, we'd like both of those things to happen without too much more delay. There's been a lot of delay already because, you know, 2020, yeah, a year like no other. So what I'm going to do is show you examples from the new IBIS, because I just love looking at the new IBIS. And, but keep in mind that you can go to the current version, and there's still a lot of good stuff there. Okay. Types of web content. So I'm going to go through these slides, you know, relatively quickly, and then we can go to the application and look at it, and we can poke around and see things live. That's kind of one of the nice things about doing this presentation from my home office here, is that I can be assured I have good internet access, right, and the application right here. Okay, so the first type of content I want to talk about are health indicator reports. These are reports that provide charts and maps and contextual information, that all important public health context, for specific health indicators like low birth weight and diabetes. So let's talk for a quick second about what an indicator is. So when, you know, in our development of IBIS, one of the quintessential examples of health indicators comes from Healthy People. You know, back in the day, it was Healthy People 2000, and then 2010, 2020, now it's 2030. So here's an example: reduce the proportion of people who can't get medical care when they need it. So this is an indicator of access to care. People who say the proportion of people who say they can't get care when they need it. It is a quantitative measure. It can be measured and reported, And a lot of times these measures have a target value. In Healthy People 2030, they all have targets because these are health objectives for the future. We'd like to lower this rate. But in IBIS, we have our indicator reports, and this is the what our analogy to the health objectives are these indicator reports. Again, indicators of community health status. So this is a screenshot of an IBIS indicator report. Percentage of adults unable to get medical care, needed medical care because of the cost over time. There's a split right here in the trend data because the BRFS survey, Behavioral Risk Factor Surveillance System, or BRFSS, survey had a major methodology change from 2010 to 2011. So they want us to present these trend lines broken. But anyway, you can see that New Mexico, after the methodology change, we've had a little higher proportion initially of adults who are unable to get care. And then around the time of the Affordable Care Act, our proportion of people unable to get care was very similar to that across the US and lower. So that was very good. In the last few years here, it's begun to diverge a little bit, but it's still relatively flat. Well, that's a good thing. Okay, so in these reports, we have the ability to present data by a variety of dimensions or data views. Sorry about that. One thing I should mention is that these reports, I don't maintain all of these reports. We have, gosh, 200 or so reports, and they're maintained by subject matter experts across the department. We have a special web-based system that allows everybody to maintain their report data. But anyway, so if you go to one of these reports, you can pull down a list of data views that are available for these data. And we'll go to the county report, and it looks like this. So you can see on the map, the counties with the darker colors have the highest proportion of people who have been unable to get medical care because of cost. This is in the last 5 years. The most recent BRFS data we have are for 2019. Okay, so that's the data part of the indicator report. We also have some pages with contextual information, the important facts, the data source and data issues and services. And then we have associated health topics. And now I'll talk a little bit more about topics in a minute. Okay, the second kind of content I want to talk about are our community reports. So the indicator reports provide data on health indicators one at a time, and you can look at those indicators by county, for instance. The community reports present data one community at a time, and you can look at data for multiple indicators. So it's kind of, one's going down the columns, the other's going across the rows, if that makes any sense. So this is what these look like in the new version of IBIS. This is the default page, community health profile by county. The counties arranged alphabetically, or more precisely by FIPS code order. And from this page, you can choose a different type of community or way of grouping the New Mexico population into subpopulations. So I can switch to a race ethnicity view. The default page here, American Indian, Alaska Native. I can go in from this page and choose a different race ethnicity within this community type. So switch from American Indian to Hispanic. And I can also, from this page, choose from different sets of indicators. So there are a variety of different sets of indicators. We've been looking at the community health status outcomes, health outcomes indicators. I can switch to mental health status. And this is a set of indicators that we have on mental health. Okie doke. The next type of presentation of data that we can find in IBIS are the dataset queries. So these provide the same dynamic maps and charts, and they provide data tables and some contextual information, not as much, for public health data sets like vital records, health surveys, infectious disease, and population estimates. And this is the menu of choices, and you can see we have quite a few data sets available. If I go to birth data, I can choose from among a bunch of different measures looking at birth data. And here I can look at, I've got a query that looks at moving averages for teen birth rates. And I can do that by race and ethnicity. And hopefully this is under an understandable way to provide the information in this trend line chart. And it's great. Isn't that great that our teen birth rates have been going down so steadily? And we hope that continues. This is a national trend, and New Mexico has been every bit a part of it. Okay. Of course, we have static web pages. These are just traditional web pages that we're used to. Things like we have a bunch of help pages, how to calculate a rate, age-adjusted rates. We have a page for downloading the population estimates data. I think Susan mentioned at the beginning that the Department of Health has a contract with the Geospatial and Population Studies group at UNM in I guess they're a sister agency to BEBR. And yeah, so we get population estimates by year, different geographies, county, and census tract. So census tract data that roll up into counties, and then we get it by age, sex, and race ethnicity. So that's been a really nice partnership with UNM and the health department. Okay, now I mentioned these health topics earlier. These are pages that provide a general overview and contextual information for a given health topic. And the other important function of our topics pages is to guide users to what's available on IBIS. So there's so much available on IBIS, and we've heard complaints over the years. One of the most common complaints that I've heard is there's just so much there, it's overwhelming. I don't know how to find what I'm looking for. So we're endeavoring to make it easier for people to be able to find things. And of course, you can search the site for any, keywords. But the other thing that we've done with this version is we've kept these, we call them the big easy buttons, and they're on the current production site also, but we've improved these topics pages, we think. So if I go to the health status topic group, one of the topics is substance use. And here's the substance use page. And you can see there's some contextual information on the left. And then on the right, there's a list of indicator reports. So the user can select from among a large number of indicator reports that we have on substance use. And then if I scroll down the page, you can see there's also, and this is associated data set queries is what that says. So these are queries, you can click on this and it will just take you to a query result for that, whatever's listed. Okay, now IBIS 3.0, just for a little overview of what the difference is between the current version 2.3 and 3.0. One of the big differences is user experience. We're trying to guide users to less complicated information first. We've tried to make the topic pages more attractive, less cluttered, links easier to see. We have multiple indicator report indexes and searching. And again, just trying to make it easier for users to find what they're looking for. We'll have the ability to export maps and graphs, easier community reports with more options, and easier to maintain. This is the community reports are, as far as maintenance goes, it's a huge difference for me between 2.3 and 3.0. And then really the big effort has been underneath what you can see on the surface, and that's our data storage. So we've gone from storing data for kind of one-time use to display in an indicator report to having a data system where we maintain data, historical data, so that the user can do comparisons. We're storing data consistently for the indicator reports and the query output, and this gives us a lot more options for using the data. So if they're provided in the same format by both sides of the house, then we can use that format in multiple ways. More options for data comparisons and data-driven features. And I already mentioned easier maintenance. More automated things, fewer lovingly handcrafted pages, which means we can do more with our limited staff capacity. Okay, so here's just an example of one of the things we're going to be able to do. I don't have any of these working yet, but because we're storing historical data by county, we'll be able to do one of these time series maps. So it's you have a slider at the bottom where that orange arrow is, and you can slide it to a new year and see how the map changes over time, or just play the map and it will slide. So those maps are kind of cool. That's just an example of one thing we can do. Creating story pages. This is something I really hope our subject matter experts take advantage of. So now we're able to pluck the map and chart out of an indicator report or even just a data query result and plop it into a static web page that displays the map or graph in its interactive, fully interactive capacity and embed it in a story. So this is really appealing to a lot of people. And I think this is an example from, I think it's Live Stories is one of these applications that does a similar kind of a thing. So we'll be able to do this in IBIS. I've done a little of this, but nothing to show right now. And then dashboard, I think this can be really useful. This is an example dashboard with infectious disease data. This is from a year or so ago. So these are query results. Our infectious disease data, including our COVID data right now, which are not public, unfortunately, but they're updated every day. So the infectious disease data are updated in like at 2 in the morning every day. So when I run a query, it's the most recent data, or it's very timely. It's not real time, but it's what we call very timely. So I can have a page that has these queries that show infectious disease data over time, with 5 years of background data, and then this year in the bold blue there, and you can see at a glance that, oh my gosh, what happened with hepatitis A? Well, there was an outbreak back in, the spring of 2019, and that's what's showing there. Okay, so those are exciting new things. So that's the end of my slides, and now what I'd like to do is to just go to the website and poke around a little bit. So let me close this and come over here. And this is an example of one of the topic pages. So again, let's see, if I start at the home page, and I have my big easy buttons, I say, let's look at healthcare services. I want to look at access to care. And here I have some associated indicator reports. And here's that report that I went to before, or that I had in the slide show with my different data views. And this is one version of the report that just gives all the graphics in one page. There's another version of the report that gives you everything. So if you wanted to print out everything in this report, you could go to this version and print this page out. It has all of the context and all whatnot. Important facts. Why is it important? Technical notes. Okay. Query data sets. One of the things I don't think many people know is that we have queries where you can compare health data to socioeconomic data or social determinants of health. So what I was showing there was injury, age-adjusted suicide death rates. Well, and I can go here. We had a user experience guy look at our pages and tell us what he thought would be best. And there's always a balance between trying to accommodate new users. We want to give them something engaging as quickly as possible. So now when you click on a data query, it takes you to the default query. And this is just all injury. I think this was injury deaths by poverty. Well, if I modify the query, I can go to the query builder and see where I'm at here. Yeah. And I can say, well, what about suicide deaths? And instead of looking at it by poverty, what if I look at it by education? And I haven't looked at this before in recent memory, but so you can see there's a gradient for the lowest levels of people with a bachelor's degree. And then isn't that interesting? It kind of starts declining among, and these are census tract groups. So these are census tracts with fewer than 5% with a bachelor's degree. And this is 40% or more of the people in the census tract have a bachelor's degree. And this is their suicide death rate. Oh, that's interesting. Yeah, so the suicide death rate is lower for the census tract with the least proportion of people with a bachelor's degree. It goes up in the middle and then comes down again. So anyway,
That's
Um,
fascinating.
yeah, so there's a bunch of these. Any death and birth, or yeah, virtually any death and birth measure in IBIS, you can look at by a variety of those social determinants of health.
So this is exactly where you would need a quadratic equation.
Is it?
Yes.
Sometime you'll have to explain it to me, but not now.
Okay.
Okay, no vehicle within a census tract. So there's a bunch of these, and I've got more coming. Now, social determinants. Let's look at something that I think would be of interest to this audience. So one of the things that the Census Bureau provides are data from the American Community Survey. And even though you can go to the Census Bureau site and it's not difficult to get these data down, I decided it would be nice to have it in a familiar format for IBIS users. So I created queries of the American Community Survey data. And at the beginning, right before this session, we were talking about broadband access across New Mexico. And the American Community Survey has data on broadband access. So here this is the percentage of households with a broadband connection. And you can see where it's lowest. I was driving in this area gosh, when was it? Last fall, I guess it was. And my cell phone didn't work half the time I was up here by Tisnos Pass. And yeah, it's people have to get in their car and drive to make a phone call. Now, what was I going
And
to say?
that would be the problem with hosting a data users conference where there are areas with no broadband.
There you go. So these people are probably not on the call today. So these maps are interactive, and I wanted to talk a little bit about what these areas are. So these are our New Mexico Department of Health small areas, which we've been trying to come up with a better name for years, but that's what they're called so far. And what they are clusters of census tracts. So we took adjacent census tracts and combined them until we had a population size that was just big enough to start computing or calculating a lot of our core public health measures. So things like teen births and suicide deaths. So you can get those by small area. Now for the American Community Survey data, you can also run these. So here's the query builder again. And these are the different geographies that I was able to get American Community Survey data for off the Census Bureau. And the smallest geography are census tracts. And then I also have a query by tribal census tracts, but it's kind of unfinished so far. If I hear that there's demand for it, I can work on it and get that out. But I'm just not sure how to present the data because a lot of times our tribal partners don't like their data to be shown compared. And when you have a map, it automatically compares. And so I've been struggling with how to present those data a little bit. So this is going across my internet to the DOH network, across their network, running it by census tract and coming back. And it takes a little while to load all 499 census tracts data. But while that's happening, are there any questions at this point? I think you should be able to put a question in a chat,
They can
perhaps.
They can put it in the chat, or we only have 38 people online right now. So I think it's enough. If you want to unmute yourself and ask a question, just go for it. And I'm
Yeah,
going
I
to
think
note, yeah, go
I
ahead.
was just going to say, I think we're pretty close to the end of this session, so we don't have a whole lot of time, right?
No, you got plenty of time, because I gave you an hour and 15 minutes, but
Oh,
we
okay.
don't have to use the whole time either.
Okay.
But just note, I'm just going to note, because I sat in on Mike Radcliffe's geography presentation earlier this month, and the number of census tracts will change for 2020. It's in his PowerPoint slide up online.
Oh, good. I'll have to go look. I've been wondering.
Yeah,
So
those tracks are out, but no data is available for them yet.
Right. Yeah, they have to decide what they're going to be first before they release any data. Amazing. Okay, so there's that same query by census tract.
You know, Lois, that's phenomenal.
Yeah, it's fun, isn't it? Yeah, I mean, there are 80 some different measures that I have on here from the American Community Survey, and you can look at each of them by any of these geographies. That community report that I showed earlier, we can poke around in there a little bit, and we have indicator data available by small area, not scads of it. Oh, and this worse. Our number one, small area number one is Bernalillo County Central Avenue in Pennsylvania. And that I think is the area that a lot of people might know as the International District. And they have poor outcomes on a variety of measures. We could, for instance, compare that to a county like Los Alamos, or a small area, which is Los Alamos County is a small area. And, you know, just an example of our huge disparities, some really big disparities in New Mexico health. For the indicator reports, one of the things that we did was provide different ways of being able to search for indicator report data. So I already showed the example with the topics, you know, the big easy buttons and going to a topic area. You can also just go to the list, and instead of browsing and searching, you can, for instance, oh, no. This is on my local machine. I may not have everything out here. Let's see. Food insecurity. So that's one way of searching. You can also, let's say that you're you're interested in looking at the latest behavioral risk factors surveillance system data. I can see it right there, but ooh, now wait a minute. Anyway, you can look at the BRFS data, what indicators are available for BRFS. We can, there's another search tool that is a table that this is the whole list of indicators, and you can see what has data views, filter is, let's see, contains small. So these are indicators that have a view by small area available, for instance, and you can control this list a little bit. Let's just, for instance, I just want to look at what's been published most recently. Okay, these are the most recent. I can see what is new since I've been on last time. So those are a couple of features that are nice. Now I don't.
So in the chat, just to cover, Kendra Montanari says, this is a great site and we use it frequently at Mr. Cog. Thank you. Exciting for the new update. Robert
Great.
Rodigan said, UNM GPS loves IBIS. I use it to retrieve our own pop estimates.
All right.
And then Judy Barnstone wants to know, wondering how fast data gets updated on IBIS. I imagine it must take some time. Saw a news report this summer about 2019 YRRS findings, but didn't see it on IBIS yet, although maybe I wasn't taking the right path for my search.
That's it. That's a really good question. So the query data are updated pretty quickly after the data set has been compiled and made available. So I get the data from the data steward. And in fact, I was just talking with Dan Green this week about those 2019 data, and he's still working on compiling the data set. So I guess he gets 5 different data sets or something and has to clean and compile each of them. And he has begun releasing results of the 2019 YRRS and from the data sets that he has compiled so far. And he's still working on his IBIS data set to get to me. I just recently got the 2019, about a month ago, 2019 BRFSS. That was my first 2019 data set this year. Usually Vital Records is available in late July or August. And this year, as you could imagine, Vital Records has been playing a key role in the COVID surveillance, COVID-19 deaths. And they've been really swamped. They have are hiring a new bureau director, blah, blah, blah. But anyway, so a lot of things have been delayed this year because of COVID-19, IBIS being one of them, the IBIS upgrade. But yeah, usually it's annually for the query data. And oftentimes the indicator reports those authors from around the department will wait until the data are available in the IBIS query to update their indicator reports. So it's usually in that order. And those indicator reports are a little more what we call lovingly handcrafted. So this is just an example of, for instance, how our indicator report authors maintain their reports. So you can see that, although it's, the reports are data driven and somewhat automated, because we maintain context, that requires the TLC from the subject matter experts. But they, once they get the data, they go in and they use this system to update the data. They can copy paste from Excel, but it still requires some personal attention. So, but usually annually, and we hope to get our data, like 2019 data, out before the end of 2020. And we like to get stuff up to date in time for the legislative session. That was always a goal, but we're kind of discombobulated with the whole COVID stuff. Anything else?
So this might be a personal thing. Can you show us how to pull the pop estimate data out of the new IBIS here?
Sure. Now, I have to confess, I don't have the 2019 estimates up here yet, but download population estimates. I have the 2019 estimates in the query though. That's actually, those are usually one of the first data sets we get in June. As you can see, I don't have the data set ready for download yet, but there's a page, and I have, so if you get the census tract data sets, that data set has small areas and counties coded. So it has county FIPS tracts in it. So if you wanted just one data set that does everything, you'd get the census tracts data set. And I have a SAS version and a comma delimited version for download, and code book and different things. I provide the data sets in these 10-year increments just to make it so that they're manageable to download. And then I provide, some people don't need census tract, they're just interested in the county data. So the quickest and easiest thing for them to do would be to get a comma delimited file of just the county population estimates by year, age, sex, race, and Hispanic ethnicity. So there's that. And then the query, you can get the estimates from the query by county, small area, and tract. And I have some, there's just their vanilla get the estimates query. And I added some labels to the default map just for fun. We had a new division director who said, I'm not that familiar with New Mexico. Where can I go to get more familiar with the county names and where everything is located and population centers? And so I kind of dressed this map up for her. And then you saw there were some other kind of different versions of population data measures, population density, age dependency ratio. Kind of an interesting rural effect going on there. All right, anything else, Susan, in the chat?
Hey, Lois, this is Robert Radigan. Hi, Susan.
Hey, Robert.
Thanks for the presentation. This is great. I appreciate the updates and to IBIS, and really like the animated maps. I thought that was a great new addition. And I really just overall what I think IBIS does is it takes so much various health data and this population data, and you talked about that balance between making something accessible to the beginning user, but also providing a way to retrieve data from sort of any perspective or any number of dimensions. And because you have so much data and because you can view it from so many dimensions, there is that it's really important that you strike that balance of like making it queryable for the advanced users, but something where the new user can dive in. And at the end of the day, it's really like the best thing to do is bring your data questions or what is it you're trying to answer to the interface, and then just start exploring, and you'll realize just how valuable a tool it is. We're talking about the population estimates, and I have to sort of shamelessly make another plug for just how important the 2020 census is, and how that is not over. The counting is over for the 2020 census, but they're still in a data processing phase, and they're still at they're still making very big decisions on disclosure avoidance and the differential privacy system that is going to insert a certain amount of noise into the population data. And that noise might not have a big impact when you're looking at something like, Bernalillo County. But when you're looking at the community level, when you're looking at a tract level, these small areas, you're looking at anything like, the rate of COVID, or the examples that Lois used here with, teen pregnancy and suicides. When you're trying to look at these rates, the Department of Health could do the best job in the world of tracking all those events, of knowing where every teen pregnancy occurred, where every suicide occurred. But you can't have meaningful rates unless you have an accurate estimate of the population at risk. And there are serious concerns about the quality of data that's going to come out of this 2020 census, and it's going to have the most impact down at these small areas. And so I just wanted to sort of use your demonstration as a chance to kind of echo to everybody just how much is at stake for the 2020 census, and how if bad data comes out of the 2020 census, it will make all of this valuable data that Lois just showed a lot more uncertain and possibly a lot, not meaningful. So thank you for letting me take the soapbox for a moment. And really appreciate the tool, and I appreciate our partnership.
Oh, that's great. That's great. It is a really good point, because I think a lot of people don't realize how important population estimates are to public health surveillance. I mean, you could look at counts all day long, and you still wouldn't know where areas were at greater risk, because you have to look at a rate. If we looked at counts, we'd think Bernalillo County had every problem. They had the worst problem of everything, because they have the most people, so they have the most deaths, they have the most teen births. But we have to look at rates. So yeah, I'm got my fingers crossed. 2020, it's always difficult making that transition from one decennial census period to the next. So thanks, Robert. Any other things in the chat?
Oh, from Paige Best, this is fantastic. Thank you, Dr. Haggard.
Hi, Paige. Thank you.
And I can't wait till the 3.0 comes up. I'm looking forward to wowing people with my knowledge of it.
All right. Yeah, so I think that's about all I had. If there aren't any more questions, I don't need to keep people on. But if someone wants me to go look at something, I can definitely demonstrate something. But yeah.
So what I'll do is I'll kind of do a closing up here. Thank you all for joining us and looking at the health data, which I think is critical today as we're in the middle of a pandemic. The next session will be at 1:30, and everybody is welcome. It is going to be the State Data Center affiliate program meeting, but we're going to cover what went well and what didn't go well. We're going to do sort of a debrief of the 2020 census, and then maybe a forward look of what's coming forward, the release of 2020 data, which looks like is going to happen in January some point, but also maybe how New Mexico and the different entities within New Mexico might be able to better work with the Census Bureau in designing the 2030 for New Mexico. So all of you, we're going to turn you all loose for lunch here, but I hope you all come back and come back for the next session at 1:30. And thank you for attending.
Thank you, Susan. Thanks, everybody.
Thank you, Lois. Oh, that's so cool, Lois.
All right. Talk to you soon. Thanks again for the opportunity.
Oh, it's great. It makes my life easier when people ask me for health data.
Good. Later.
All right. You have a good one.